Hello and welcome along to the industry analysis for the strategic case study of May 2019. Here we're going to be looking at the real-world private healthcare industry, and the purpose of the industry analysis is to present to you some of the real-world trends, some of the real-world developments that can then help you to anticipate some of the issues and scenarios that might arise on exam day. So before we get into the meat of the industry analysis, let me just give you a quick overview of what we're going to be covering. The first section will look at broad global industry trends in the private healthcare industry, particularly looking at some of the key figures and projections for the coming years. From there, then, we're going to move into a specific case study of the UK industry in particular, and I'll explain the reasons why we're going to be focusing on the UK industry vis-a-vis the pre-scene. In section 3 then, we'll look at some important health innovations and technology developments that have occurred in the last few years and the implications of those innovations for the private healthcare industry. We're then going to look at a very interesting case, another little case study of a company called Theranos, and I'll be explaining why, again, that is important from the perspective of the pre-scene and this particular industry. Section 5 then, we're going to be drawing everything that we've covered so far together, all the strands bringing together to look at some of the key opportunities and potential threats that face private hospitals and companies operating within the private healthcare sector. And from there then, we will conclude the industry analysis. So let's get into it. We're going to look first at the global healthcare trends, some of the broad figures and projections for the coming years. Here we're looking at total health spending for a number of different major regions in the world. And this is as a percentage of GDP, and these are prices adjusted for inflation. So we're not looking at nominal prices here, we're looking at real prices of total healthcare spending from 1970 to 2015. And just this gives you a sense of the growing importance of healthcare from a political and economic perspective. Spending has increased in all of these major countries, the USA, the UK, Japan, Germany and Australia, and it shows no real signs of slowing down in the coming years. The only country there really that shows signs is perhaps the Japanese case, because Japan has historically exceptional health outcomes, and for that reason there's perhaps less political pressure for spending to steadily increase year on year. But in almost all developed and developing countries indeed, healthcare spending is constantly going up. Now we're looking primarily at the private market here, looking at it from the perspective of health insurance policies and premiums. And again, this is a steady growth segment. Private health insurance, of course, is a really key part of the private healthcare market overall. And of course, private hospitals, the vast majority of their patients and their revenues still comes from private health coverage. So you can see here, on the left from 2015 to 2025, the projections are quite healthy, steady growth rates right up to 2025, and we're looking at a total market value of 2.6 trillion by 2025, so a really significant market there. Growth and profitability of different insurance lines of business. You can see here there are 3 different categories: P&C, life and health, and you can see the averages here from 2010 to 2014 and from 2015 to 2025. So this is growth rates, compound annual growth rates, and you can see from 2010 to 2014 very significant growth in the health insurance segment. That growth is expected to continue, and health is expected to be relatively favourable in terms of growth rates compared to P&C and life. P&C is basically just general insurance. It's an umbrella term that covers various kinds of insurance, like, for example, car insurance and property insurance and so on and so forth. And then you've life insurance as well. Health insurance looks like it's going to continue its healthy growth rates and return on equity to 2025 as well. So in terms of private insurance, health is one of the big ones, both in terms of compound annual growth rates and returns on equity, and that's expected to carry forward into 2025. The private payer market is expected then to grow in all regions as well, but there are some interesting differentials to look at here in terms of regional projected growth. Looking at Europe in particular, It is a surprisingly modest growth rate, perhaps 0.3 there you can see on the right in terms of its compound annual growth rate projection from 2015 to 2025. And you compare that to places like Latin America and the Asian Pacific region, it's going to be seeing much, much healthier growth, and indeed as well after tax returns on equity. So if we're dealing with a company that is based in a European or a European-like country, then of course we can expect it to be a more modest growth projection going forward. And you can see there 3% per annum is the projection from 2015 to 2025. So that is something to bear in mind. We're looking at much more aggressive and healthier growth rates in places like Latin America and the Asia Pacific region. Here we're looking at the income levels and the impact of income levels within countries and regions on the different kinds of diseases and disease burdens that affect those kinds of countries. And you can see, not surprisingly perhaps, that low-income countries tend to suffer more from communicable diseases, that is to say contagious diseases, and things like cholera, for example, and diphtheria, and some of those more traditional infectious diseases, whereas the more developed and high-income nations tend to have a higher percentage of non-communicable diseases, and that would include diseases like, for example, cancer, heart disease, and so on. Some of them more chronic diseases that are more associated especially with old age. And so when you have a higher income country, of course, you tend to have a higher average age, and you tend to have longer life expectancy, and that then results in turn in a higher proportion of illnesses like cancers and heart disease and so on, and things like Parkinson's, dementia, and various other diseases associated with old age. And you can also see there as well, for high-income countries, it might seem a little bit counterintuitive at first when you see the proportion and percentage of injuries being associated with hospital visits. But when you think about it again, this is something that can be easily explained in terms of both the higher average age and the longer life expectancy. So you're going to have more old people, and they're going to suffer from things like falls, for example, and so on. So that is basically the way of explaining those figures in the high income context: more non-communicable diseases and more injuries suffered as well. So that's of course going to result as well in more visits to accident and emergency rooms in developed countries. And again, bear that in mind for private hospitals, because of course private hospitals in the context of the pre-scene, they do not have accident and emergency facilities. They primarily focus on things like surgery and management of chronic or non-communicable diseases. Obesity is a really important point from the perspective of healthcare, and obesity rates globally have skyrocketed in the last 20 to 30 years as food consumption and food production has improved. Mass food production in particular has improved. It has resulted in the wider availability of food and lower prices, and of course people have a tendency to overindulge, especially in developed nations and indeed in developing nations. And those rates, the prevalence rate of obesity has increased significantly in several countries over the last say 10 to 15 years. And you can see there that there are a number of main offenders. You've got Cook Islands and Tonga and Palau are way out. These are interesting kind of outliers. But then you've got more obvious countries like the United States and the United Kingdom in there as well. Mexico has a notoriously high obesity rate as well. So those are going to put a huge amount of pressure, unsurprisingly, on the health industries in those countries. You can see then down at the bottom left, a place like Japan, for example, has very low obesity rates, and it's not surprising then that they tend to have very good health outcomes. Not only is that attributable to their actual health service, but it's also attributable to a more sustainable and healthy overall lifestyle and culture surrounding things like food in places like Japan. That is something important to bear in mind as well from a political perspective, and in terms of GDP spending on healthcare and public spending on healthcare. Often what will happen is in developed nations you will have high rates of obesity, and that will lead to a lot of associated health problems like heart disease and cancers, for example, increases the risk in those countries. So what happens is often actually the health outcomes in those countries are bad, and people tend to blame those bad health outcomes entirely on the healthcare system, and then that puts increased pressure on governments to up the spending on healthcare in those countries. But actually, it turns out that a lot of the bad health outcomes can be attributed to lifestyle choices rather than a defective healthcare system in itself. So that is an interesting political point to bear in mind, and the dynamics there are very interesting, because you might often find that in those developed nations, this is throwing money at a problem when in fact the root of the problem is outside of the actual healthcare system itself. So something to bear in mind there. Ironically, perhaps health awareness has increased in conjunction with the increased rates of obesity, especially in developed countries. And I suppose you could read this as a reaction against the increasing recognition that obesity is a problem. People in recent years especially are becoming more health aware and health conscious. You can see here on the left, consumers seek healthy food. What are the most important criteria for food purchasing decisions? This is from the percentage of respondents. You can see 47% say no genetically modified ingredients, 42% say natural food, and 40% say it contains vegetables and or fruits. Now, there's a certain amount of irony in these figures, perhaps, especially given the fact that genetically modified foods have actually been shown not to be risky or more risky from a health perspective compared to non-genetically modified foods. And in fact, non-genetically modified foods have been shown to have no additional health benefits over and above genetically modified alternatives. So that is something of a myth, but at least this does seem to be the perception that most people have, is that genetically modified foods are bad for your health, and so they try to avoid them. So at least the health consciousness is there, even if it is actually in practice incorrectly implemented. Then you have also natural food is 42%. Again, the research suggests that actually natural isn't necessarily always better. For example, people often buy organic foods, but there have been extensive studies done on organic foods versus non-organic foods. That is to say, organic foods using natural pesticides versus non-organic foods using synthetic pesticides. And actually, it's been shown that natural pesticides can be just as toxic for human consumption as synthetic pesticides. And pesticides in general are necessary in food production in order to avoid huge amounts of loss and contamination, for example, from naturally occurring pathogens. And so again, there is a bit of a myth there and a kind of a mistake. It's called the appeal to nature fallacy. People often mistakenly assume that natural foods are necessarily better, when actually that's often not the case. But again, the point here is that there is increased health consciousness, and people are offering this as a criteria for their food purchasing. The one that really does stand up to scrutiny, of course, is containing vegetables and fruits, and obviously there's very strong science to support vegetable and fruit consumption being associated with better health outcomes, and so that is, at least of the three, more solid scientific ground and scientific footing. So that is an indication that health awareness is rising, and in terms of people's health or food choices, I should say. The more important, I think, and significant indicator is the one on the right here, which is in terms of physical exercise and the increase in interest in physical exercise. Membership, for example, in German gyms, which is a very good representative developed nation, an advanced nation with a good healthcare system. And the increase in membership of gyms is really skyrocketed over the last few years in developed nations. And that obviously is going to be associated with much better health outcomes, because again, the science is very strong on the health benefits of regular physical exercise. So that is something that hopefully in the next few years we'll start to see will reduce the pressure on healthcare systems in developed nations. And you can see here more evidence of this increased health consciousness, searches for fitness topics versus books in general. And you can see there, perhaps depressing from the point of view of education and intellectual pursuits, but certainly people are turning more of their interest and their mental energy to studying things like fitness and how to improve your physical well-being. So that's, again, another strong indicator that things are improving in terms of people's health awareness. So we're looking here at some more qualitative factors shaping the industry, that is the private healthcare industry in general, going forward. An aging population and income growth are increasing healthcare consumption. So that's obviously going to put pressure on the healthcare industry and demands for increased public spending. Global population of people aged 65 and older is climbing by 3.1% per year. That is a really significant compound effect when you look at it over a number of years, and likely to almost double from 2010 to 2030. And from the perspective of general global development, that's really good news, because of course it means people are living longer, poverty is reducing, and there's lower child mortality rates, for example, that translate into those figures. So that is really positive news overall. But of course, from the health industry and private health sector perspective, it means you're going to have to reinforce your investments in things like, again, those chronic diseases, those diseases that are non-communicable. They're the ones that are going to be more prevalent in terms of percentages. So that is something to bear in mind. The proportion of the global population with middle class incomes, 26.5% in 2009, is expected to rise to 58.8% by 2030. That is to say 4.8 billion people. Projected growth of the middle class is especially strong in the Asia Pacific region, which we looked at a little bit earlier on in terms of projected growth rates. Very positive indeed. Another factor shaping the industry going forward, healthcare consumption is further increasing because the global disease burden continues to rise. As incomes rise, childhood mortality decreases, and then non-communicable diseases, especially chronic conditions, become more common. Around the world, the prevalence of overweight and obesity, obese people has risen dramatically, as we saw earlier, obesity rates, and that has profound impacts on then the healthcare infrastructure. Another important point to bear in mind here pertains to recruiting staff. Staffing can represent up to 70% of a hospital's costs, so a really huge proportion of it there. Think about it again in terms of the pre-scene. Remember, you've doctors, you've junior doctors, you've senior consultants, you have nursing staff, you have catering staff, you have cleaning staff, and so on. There's a huge roster there of really indispensable people who are very important in terms of retention, and especially in the private healthcare segment, where the standards, as we saw in that pre-scene, tend to be higher in terms of the expectation of things like comfort and food quality and so on and so forth. And if you get good people in the door, you are going to be anxious to keep them, and you want to keep that turnover low as possible. Continuity is something that's going to be important for patients as well, the sense that they're being seen to by the same people who understand their background, their context, their condition and their needs and so on. So staff retention is a really huge issue, especially in the private healthcare segment, so something to bear in mind as well. Causes of current staffing issues: increased demand and heavy workload. That obviously is related to the factors that we mentioned earlier. Poor work-life balance. Increasingly, doctors are coming under heavy strain, especially in the public sector, in terms of trying to avoid waiting lists because of the huge demand on the healthcare industry, especially in the public sector. It's a little bit difficult for them to strike the right work-life balance, and that's in creating all sorts of associated problems. That's leading then in turn to declining morale and well-being concerns, especially amongst young doctors who are feeling a real burden of pressure as they have a lot of work unloaded on them by their senior consultants, for example, who might want them to take on a heavier burden, and also to train them and to make sure that they're developing correctly. So those are important psychological and indeed economic points to bear in mind. We come now to the UK industry, and this is a really important case study because I think there are many common points and very many comparable points between the real world UK industry and the industry that we're presented with in the pre-scene. For that reason, I think it's important to look at the UK industry. We're going to see several parallels with the pre-scene. For example, you have the NHS versus the KHS, the National Health Service in the UK, and you have the Keeland Health Service in the pre-scene. Obviously, we're dealing with in both cases, developed, prosperous nations, relatively speaking. Universal healthcare is present. Waiting list issues are also present. The use of private hospitals by the NHS and private individuals as well. That's paralleled in the pre-scene because, of course, we know that private hospitals are sometimes used by the KHS in order to avoid overrunning their deadline in terms of waiting times for treatments. And we're going to look into some of the implications of this in the real world as well, because you have similar structures in play in the NHS. So we're going to look at some of those interesting parallels, but I think more important and more interesting still are the differences between the UK industry in the real world and the one that were presented in the pre-scene. I think the reason this is important because this might give us some clues as to the kinds of scenarios and changes that might actually be implemented and introduced on exam day for this particular case study. So looking at some of the kind of broad trends and figures for the UK private healthcare market here, you can see it's expected to reach approximately 13.8 billion US dollars by the end of 2023 with a compound annual growth rate of 2.6%. So not a spectacular compound annual growth rate, it has to be said. It's a pretty modest one. And if we look at it in terms of the context of the overall spend by the Department of Health in terms of its budget for the UK, you can see it's fairly modest percentage of the overall of the total. By 2021, the total UK figure is expected to be close to, well, this is for England, 128 billion, but for the total in UK, it's going to be closer to around 150 billion by that point. So if you go back and consider then, this is in dollars, of course, you have to take the exchange rate into account. But if you're looking at around 13 billion by the end of 2023, we could say that maybe we're going upwards of 160 billion by 2023, taking these figures into account in terms of the Department of Health projected budgets. So it is not a significant percentage of the overall healthcare spend. The vast majority is going towards the public sector in terms of overall GDP percentage spend in the UK. So it is something to bear in mind that the private healthcare industry is a relatively small sector or segment within the overall healthcare industry in the UK. So you can see here, this is a nice breakdown of UK private hospital revenues, where it's coming from, and this is to 2015. And you can see over the last 10 years, well, from 2005 to 2015, the percentage of the revenues coming from the NHS has increased quite steadily to take up 27% of the overall take for private hospitals, and that was compared to 10% overall take back in 2005. So that is a really significant increase, and it does show that to some extent, to a significant extent, the revenues of the private sector are still depending on the NHS and on the public spending. So if there is any kind of significant cut to spending in the public sector, in the NHS, that could have a detrimental impact on the private sector as well. The vast majority, of course, is still coming from private medical insurance. Unsurprisingly, it's at 42% of the share of the total revenues in 2015, but it is a lower share, it has to be said, in relative terms compared to the share that existed in 2005, but it has increased in absolute terms, of course, as you can see in this chart, but it's still a lower percentage of the overall take, and that is accounted for by the fact that the NHS's percentage of the overall revenues for the private sector has actually increased in that period. Here we're looking at the revenue breakdown at independent hospitals and clinics in 2017 by type of payment. And you can see here again, unsurprisingly, private medical insurance accounts for the vast majority, but the second place is significantly the NHS. And then in third place, you have self-pay, that is people who are paying just out of their own pocket directly rather than via private medical insurance. And then overseas is at 0.153%. That is to say, what's also known as health tourism, people coming from overseas to get the best care that they can find in the UK. Top treatments at private hospitals then. This is looking at the types of treatment, the most valuable in terms of revenues by specialty. So you can see oncology, obviously related to cancer treatments, account for almost 25% of the London private sector market and are the largest specialty by revenue. And these figures are more or less reflected throughout the rest of England and the UK. Orthopedics, that is in terms of private hospitals, bear that in mind. Orthopedics then is at 257. So £257 million compared to 378 for oncology. And then cardio comes in next in third place, and neurosurgery, neurology in fourth. So you can see there in terms of the proportions that these are chronic diseases. These are the diseases that are non-communicable. These are the primary source of revenues for the private healthcare sector.